Good morning to one and all. Respected panelists and enthusiastic participants, on behalf of Narayana College of Nursing, we are welcoming you to for the second day of 4th International Conference webinar series on clinical sequelae of COVID-19 survival womb to tomb. Let us start our program with a prayer song.
It is not audible.
Yes, ma'am. Yes, check this.
No, it's not audible again.
Is it audible, ma'am?
गजाननं भूत गणादि सेवितं कपित्तजम्बू फलसार भक्षितम् उमासुतं शोकविनाशकारणं नमामि विघ्नेश्वर पादपङ्कजम् गजानन पद्मार्कं गजाननम् अहर्निशम् अनेकदन्तम् भक्तानां
Now, let us listen our institution welcome song.
No, it's not audible, Smita.
Ma'am, is that audible?
No, it's not audible.
With the lamps in your hands and the songs on the lips, to the temple of love, to the temple of love, we welcome you here. We welcome you here. To the world of in and I, to the world of in and I. The brighter the light, the brightest together. Knowledge and wisdom, oh, service forever. Will make your desire, will make you so higher. We welcome you here, we welcome you here. To the world of in and I, to the world of in and I, to the world of Narayana.
Now let me call upon today's first presenter, Dr. Rajeswari Ma'am, HOD, Vice Principal, Department of Mental Health Nursing, Narayana College of Nursing, with strong knowledge and interest on nursing field analysis and development of skills in a rapidly growing nursing field to meet the demands. She involves in intensive research activities with more than 20 years of clinical and teaching experience in different positions and about 9 certification courses and 23 publications in different national and international journals. Even Madam has presented 19 scientific papers and among few are even awarded best. She achieved many achievements in outreach activities too. We welcome you to present your topic on this day, ma'am. Over to you, ma'am.
Yeah, thank you, Usha Kiran. We'll start with today's session. Since yesterday we have been listening, like is my screen visible to all of you?
Yes, ma'am.
So since yesterday we have been continuously listening about this COVID. Okay, so when we are listening about this COVID itself, so there is some kind of fear, or there is some kind of anxiety, or there is some kind of disturbances that is taking place within ourselves. Okay, like when we talk about health, so health includes both physical health as well as mental health. So when physical health is affected, automatically it will be affecting our mental health status also, and it is vice versa. So what happens whenever we are suffering with this problem of COVID? So what is happening to our mental health? though we have been taking care of our physical health, okay, there are some problems that are happening. And what are the problems that are happening? And after this COVID, or after the COVID infection, or after this pandemic gets over, what are the different kinds of problems people will be encountering with? How are we going to deal with that? Okay, because it is not like something it is going to stay for a day or a month or a week. It is going to, this problem are going to occur for us even after some period of years also, we can say. So what are those kinds of problems? How we have to tackle it so that we are able to maintain both physical health and mental health? That is what is a topic that I will be highlighting a few aspects, and I will be giving my presentation in a nutshell of how to manage so that we prevent the occurrence of the problem. At the same time, if the problem is happening, how we are going to manage. So the topic given for my presentation is psychic sequelae of COVID-19. So we have learned a lot about the statistical information regarding how many people are affected. So they say that about 80 million people have been infected with this COVID syndrome worldwide, and about 1.7 million have died. And this impact, okay, is going to have a major catastrophe on all the individuals, not only people who got affected, even the people who are normal, who are not infected. On everyone, it is going to have a major collision, and it is in the forthcoming years, people are expected, and they have predicted that many will be affected with many kinds of mental health issues. So more than the physical health problem, the mental health problem will be the priority one, and more number of people are going to be affected with that. Okay, so why this is happening? Okay, what happens? So they say that the biological factors and the environmental factors, where the abnormalities in electrolyte, the process of liver inflammation, and impairment in the renal function, especially the important point is your oxygenation. So whenever the brain goes in for an hypoxia, especially during this COVID infection, okay, most of the time the individual is going for an hypoxia, which is going to lead to the problem of impairment and hyperinflammation. So all these things are combined together and forcing the individual to lose his physical health, and at the same time, there are also some physiological process that is taking place in our body, which is affecting our mental health also. And the viral induced inflammatory response. Okay, so this COVID is very strong enough, the virus is very strong enough that it crosses the blood-brain barrier very easily, and it causes this immune cell infiltration and also the central nervous system tissue damage. So which is a very important pathophysiological factor why more number of people are getting affected with neurological disorders as well as the psychiatric problem. And this viral invasion is mainly taking place onto the vascular endothelium. So thereby what it makes is, it is activating the thrombotic and inflammatory cascades, where it is going to lead to a hypercoagulable state, leading to a lot of cerebrovascular events. Okay, and they say that stroke itself is a risk factor for depression. And we are during this post-COVID period, there are an increased number of cases where the COVID patients are getting affected with the stroke, and they have got a poor there is a poor outcome with an increased risk factor. So these people in future, they are more prone to get affected with the problem of depression. And if you take, okay, when the SARS coronavirus is getting entered into our nasal cavity, so it affects our olfactory nerve, so where it is going to affect our piriform cortex and leading to anosmia. And that is the first early symptom, like all will be encountering, where it is again going to spread to the central nervous system. So through olfactory system only it is reaching our brain, and it is directly going to infect the central nervous system, where people are going to have dizziness, headache, psychiatric symptoms, encephalitis, and respiratory failure. So there is another mechanism of central nervous system damage, where there is a cytokinin storm that is taking place, which is leading to the systemic dysregulation of homeostasis. So as a result of it, people are getting affected with acute cerebrovascular diseases, acute hemorrhagic necrotizing encephalopathy. So all these problems are going to have an impact over the mental health functions, or what we call it as the higher mental function. And if you take, if you see this graphical presentation, you can see that the patients who are getting affected with COVID in their acute stage. Okay, so there is an increased level of anxiety, phobic anxiety, and appetite and sleep are disturbed, and somatization is very high, and psychotism is taking place. And even in the post-COVID also, okay, the early stages of recovery also, people are getting with a higher amount of psychotism, paranoid ideas, anxiety, and depression. So this is about how many people are getting affected with the various kinds of problem. And during this acute phase, okay, of this COVID, what are the different psychological problems or psychiatric problems people are developing? One is acute stress disorder because of the isolation and the disease process itself, the prognosis, whether patient will become all right, or whether I will be encountering with complications, whether it will lead to death to me or not. So like that, because of that, they undergo acute stress disorder and adjustment disorder. Okay, suddenly, man is a social animal, and immediately after the encountering of the disease, we are isolating himself or we are quarantining. So that itself is affecting the mental health. And anxiety, as I already stated to you, separation anxiety is very high, and generalized anxiety is also very high, whether I will catch up with the disease, okay, whether something will happen to me or not. And depression, okay, so depression mainly occurs because of loss of employment or financial issues, and as a result of it, there is an increased suicidality also, and dysphoria, okay, and acute manic episodes. Sometimes they say that because these manic episodes are mainly considered to be developed because of the intake of steroid drugs and eating disorders, especially increased restricting the diet or binge eating, because we are not moving, there is no movement activity at all, so I need to control myself. And insomnia and irritability are very common, panic attacks were very common, phobias, fear of capturing the disease, and obsessive behavior, acute psychosis. And during this lockdown period, okay, even though the government has put a lot of restriction, but still people were craving for alcohol. And not only that, there were a lot of people who are already having the problem of alcohol or drug dependence. Many of them have developed the withdrawal syndrome. And there are some symptoms which are medically unexplained, okay, because of the psychological fear or because of anxiety and symptoms. Everything happens to them, and that is leading them to have a distress, and as a result of the distress, leading to various other psychological issues. And during the convalescent phase, okay, convalescent phase is very, very important, because during this period only we encounter a major four psychiatric disorders. One is depression. So following, like, what will happen to me, whether I will be healthy. Many people and many researchers are telling that I will be suffering with many kinds of health issues in the future. So what is going to happen to me? And during this period of illness, okay, they would have lost their job or financial problem, issues with the other family members, and psychosis. So psychosis is also another common problem that takes place during the convalescent phase, and post-traumatic stress disorder. So they have predicted that even after 1 year of getting recovered from the illness, people will be suffering with this post-traumatic stress disorder. And post-viral chronic fatigue syndrome. So this is one of the very common disorder that is affecting people nowadays, and they are suffering with this fatigue problem, and because of the nutritional requirement, still the balanced nutrition is not taken up because of the loss of taste and the loss of smell, anosmia. And as a result of the disease process itself, okay, the individual feels very tired, and this is a very common prevalent disorder among the people who are in the convalescent phase. Okay, and Oxford University research have told that about 1 in 3 COVID-19 survivors are experiencing mental health or nervous system disorders within the 6 months after the discharge. And they have identified that anxiety and mood disorders are the top leading disorders among all the psychiatric disorders. And even about 2% of the people are reported to have loss of memory or symptoms that are associated with the dementia. So they say that this post-COVID is going to have a major impact on the mental health of the individual. That was the conclusion given by Oxford University. And there is also another research which was conducted from the patients who are affected with the COVID, and they have experienced like 28% of them had the post-traumatic stress disorder symptoms, and 31% were affected with depression, 41% with anxiety, 20% with obsessive compulsive symptoms, because now we have the fear of germs and dirt. Okay, so every time we do hand sanitization and take bath a lot of time and clean our environment, so people are getting obsessed with that, and 40% of them are getting affected with insomnia. And because of this problem of insomnia, one important factor which is going to affect our mental health. So whenever there is any disturbance in the sleep pattern, that is the first indicator that, okay, your mental health is getting started to get affected. So whenever the problem of insomnia takes place, we need to give an immediate attention, because that is the first signal which is given to the individual, indicating that there is some problem that is happening related to your mental health. So we need to give attention and follow the measures so that we are recovering from that problem. And the neurocognitive disorder. So what are the problems that is taking place? So they say that 34% of them have reported memory loss. Okay, this is because of the cerebrovascular events that has taken place, and 28% of them have an impaired concentration. So these two problems are commonly reported by the individual after 3 months of discharge. And delirium occurs in at least 30% of the patients who are hospitalized with the COVID because of the environmental changes, as well as it is related to your central nervous system events. And loss of olfaction. So they say that the loss of olfaction is an early manifestation in Parkinson's disease. Okay, so though this is a very common symptom among this COVID, so the patients who have had the loss of olfaction, we need to continuously have a follow-up with them, so that we are able to detect whether they are suffering with the Parkinson's disease or not. And not only that, they are also at higher risk of developing Parkinson's disease as well as multiple sclerosis. Okay, so they say that this has got multiple sclerosis and Parkinson's disease are very closely associated with COVID infection. So we need to very carefully monitor this patient during the follow-up period, because we definitely need to identify the early symptoms so that we make an appropriate treatment for them. And encephalitis. Okay, so encephalitis, it is a very common problem. So they say that it is going to have a long-term sequelae, and which can lead to epilepsy, bipolar disorders, psychotic disorders, anxiety disorders, cognitive problems, and dementia. So the long-term sequelae need to be monitored, because early identification of these disorders are very essential. And they also say that during the acute illness, about 27 to 41% of the patients had symptoms like confusion, depressed mood, anxiety, impaired memory, and insomnia. So these kind of patients need to be intervened so that the problems are managed and the symptoms are reduced. And another one important factor is that your mood and anxiety disorders. So we know that during the treatment of COVID, the very common drug that is used in the treatment is your steroid. And now they have identified that because of steroid, the steroid is inducing manic symptoms as well as psychotic symptoms. So when the steroid drug is given, it is very essential that the correct dosage is given to the patient, and only when it is essential. And second thing is, even when the patient is taking the drug, he has to take properly, and the tapering of the dose need to be done properly, so that he is not getting affected with other kinds of symptoms. And post-traumatic stress disorder. So about 20 to 30%, there is a prevalence of post-traumatic stress disorder. And the very common risk factor is the younger age group. The younger age group of people female gender, a need for the ICU level of care, and having a past psychiatric history. So these group of people are the very common people who are going to get affected with this post-traumatic stress disorder. And they have also identified that the high rates of obesity, diabetes, metabolic syndrome, cardiovascular disease, and autoimmune disease are observed in these patients. And 20% of them are critical care survivors who are experiencing this post-traumatic stress symptoms at 12 months after the discharge. Okay, so the post-traumatic stress disorder, we need to very carefully monitor, because people are encountering with this, and there is a higher prevalence rate. Day by day it is increasing. And psychosis. So about 4% of the people exposed to this viral infection are developing the psychosis. So though comparing to the patients who developed the psychosis precipitated by this pandemic related stress, these patients are be less likely to endorse paranoia, okay, suspicion. All the time they have some kind of suspicion related to COVID, whether again the COVID will, they will be acquiring the COVID virus, or some problem will happen, even some kind of health issues will happen or not. So they may be very suspicious. And the delusional content, okay, false fixed belief they will be having. And another one important point to be noted over here is, they say that chloroquine and hydroxychloroquine can precipitate psychosis. Okay, so though this is opted as the drug of choice for the treatment of treating the COVID, but still the researchers have been identified that this intake of this drug for a prolonged period of time can precipitate the psychosis. Okay, and even high doses can also lead to psychotic symptoms. And substance use disorder. So this is very, very have become very common, and even the hospitals have reported that the number of people, the new cases of substance use disorders have been increasing. They say that 1 out of 10, every 10, they started using these illicit substances, and now the government has banned the sale of like selling the alcohol. Then what happened is selling that in the black market, so that has been increased, and there is an increase in the use of quantity and the frequency of these substances. So across all the patients with the COVID-19, so those with this comorbid substance use disorders have required more hospitalization, and the number of deaths were also high among the people who had the habit of substance use. And the vulnerable people, okay, especially these vulnerable people, those who had the suppressed immune function, okay, due to complex opioid immune modulation and drug interaction. So this also again has become another factor. And during this COVID pandemic, there was a use of opioid drug for the treatment, and that has also had an impact over the people. And panic disorder, okay, so they say that suffocation trauma, so which is mainly considered to be the factor of this panic disorder, and that is mainly people are affected with more of respiratory symptoms. Okay, even when a very suddenly a shortness of breath, okay, some kind of chest tightness, immediately people started to have this suffocation trauma. Suffocation trauma is like they are unable to breathe, and they feel like, okay, they have acquired the COVID infection, and as a result of it, okay, they exhibited the symptoms of panic disorder. And the potential consequence, okay, of this pandemic, what has happened on the panic disorder. So one is the people started to have a catastrophic interpretation focused on their breathing. Okay, so whenever they were more focused on breathing, that aggravated the panic symptoms in the patients, which were called it as a respiratory panic disorder, or we can say that the patients had a greater psychological repercussions. And not only that, because of this pandemic, people have become to show a lot of increased respiratory symptoms, and in that they started to exhibit more of hyperventilation. And not only that, people have become hyper vigilant in monitoring their own respiratory status, okay, especially checking the saturation frequently, even though they don't feel any discomfort, okay, and all the time concentrating on the respiratory part, whether even a milder cough, they immediately think about, okay, whether I have contracted the COVID, and even some kind of breathing difficulty, immediately thinking about, okay, what has happened to me, or some kind of throat irritation, immediately they think about whether they have acquired a COVID infection, and this resulted in a lot of respiratory panic symptoms and obsessive compulsive disorder. So we need not tell about this, because of this COVID viral infection virus. So there is a fear of dirt, and we have a feeling of being contaminated. As a result of it, there was an excessive washing of hands. So we all know that either we do with the soap and water, and we carry a sanitizer everywhere, and always sanitizing ourselves. And this has become like a habit for the individual, and they say that about 50% of the patients are still affected with this problem of obsessive compulsive disorder. And they also identified that the long-term excessive hand washing has emerged in the post-quarantine phase also, and fear, stress, and anxiety. Okay, so that was the main factor, and as a result of this, the incidence of OCD has been occurring, and there is also a report that there is also worsening of symptoms. And chronic fatigue syndrome. So post-viral infection, people have reported about 53%, more than half of the percentage, have reported about chronic fatigue for 3 months after the COVID infection. So it is really essential that yesterday there was a presenter, Mrs. Vijay, who was talking about the importance of diet. Okay, so we need to take an adequate amount of well-balanced diet, so that the fatigue, we are able to overcome the fatigue. And even the Johns Hopkins University researchers, they have told that, okay, the post-COVID, there is a serious problem, so which is called as myalgic encephalomyelitis or chronic fatigue syndrome. So they say that it is a multi-system disorder, which was previously known as the chronic fatigue syndrome. And there is also another problem called as post-intense happening for the patients who are admitted in the critical care. And if it is going to be the family members, so family members, because of the hospitalization of the people, of their own family members, so they got a more number of anxiety, post-traumatic stress disorder, depression, and complicated grief were reported by them. Okay, and from the survivors, it is identified that they had the anxiety disorders, post-traumatic stress disorder, and depression, and cognitive functions, impairment in the cognitive function, especially the executive function, the memory impairment in the attention, and the visuospatial orientation, and mental processing speed were impaired. And they also had pulmonary, neuromuscular, and physical impairment were also there. So this was commonly noted among the patients, especially who were admitted in the intensive care units. So what we need to do for this? Okay, so yes, there is a lot of problem. So what we are going to do for this? Okay, understanding what the risks are. Okay, so what are the risks that can happen? Who are at the risk, and how we have to manage? So one is, like, we have to identify the risk. So identify what kind of trauma. Like, definitely there is some kind of inflammation process. There is an immune dysfunction because of the COVID. And because of that, they may acquire the psychiatric diseases. So they may be requiring psychotropic as well as psychotherapeutic intervention. So first, we need to identify who are all the people who are at risk. Okay, then at-risk patients. After you identify the at-risk patients, what we have to do is, we have to identify them, and we have to start treating them with primary prevention, and then manage it. So what we need to do? So we have to monitor their symptoms, okay, and then we have to treat them, and we have to make a report also. So this is what we need to do. You identify the risk, because you know that now we know that what are the problems that can happen over the individual. So we have to screen. So whenever there is, whenever you have, it is not only for the patients who got acquired with the acquired and treated with the COVID infection, even it is for the normal people also. So we need to identify them and screen people for anxiety, depression, post-traumatic stress disorder, because these are very commonly prevalent. And then we can screen for any like memory impairment, because that is very commonly reported symptoms, screen for them, and we have to start with our preventive interventions. And if it is required, then we have to go for the managing, okay, use of drugs and other psychotherapeutic interventions. So now we'll see what we need to do. Okay, so first intervention that we can do is the psychological debriefing. So it is nothing but it is a procedure which includes about counseling and giving information to the people, so that we are preventing the psychological morbidity and aiding recovery after the traumatic event. So this is very, very important and one of the very therapeutic intervention which helps the people to come out of their problem. So we definitely need to include all people. It is not only for people who acquired the COVID infection. It is for all human beings who are living in this world. And what we need to do that, what we will be doing in that. So first one is you were given welcome to them and given introduction about, so, okay, why we are having this debriefing session. Okay, and you have to check with them. Okay, ask their name, and you find out how they were involved in the care for the patient or for the family, because first we need to understand like how the impact has happened over them, and then collect the factual information. Okay, sometimes there may be a death. Okay, they may be undergoing a grieving process. Okay, or there could be loss of something, not only a life. It could be loss of anything. It could be a status. It could be finance, or whatever it may be. Find out, and then we have to make a case review. Okay, what was it like taking care of this patient? Okay, and what is the most distressing aspect, and what is the most satisfying aspect? So we need to find out the answers for these three questions, and then we have to find out what are the grieving responses they are having. Okay, what have you experienced since the death? Okay, that means what kind of changes they have observed in their physical health, emotional, behavioral, cognitive, and spiritual. Sometimes we say that there is no God in this world, and that is why all these things are happening. So you have to find out what is their response to the grief. And emotional. So what will you remember most about this patient or the family? So we need to ask this question and elicit their response. And what we need to do. So what are the strategies for coping with the grief? Okay. So we have to continue like how they were taking care of the people or the family members, and what kind of grief coping strategies they are adopting. What are the resources that are available? Okay, and then so what did they learn like when something happened, or when they took care of the people? What did they learn about that? Okay, and then you have to tell them about like if good thing has happened. Okay, this has happened is happened. There are some things like we cannot make it, and instead of clinging on to the past, we have to let go and move with the present. Okay, so identifying resources and then facilitating or involving them in those resources will be very helpful for them. So during this psychological debriefing, so it is nothing but we are releasing up all the bottled up emotions that they are having inside. So that itself is going to serve it is going to solve the majority of the problem. So any kind of individual we can involve in psychological debriefing. Okay, so next is psychological first aid. Okay, so we all have heard about first aid, but psychological first aid. So it is a new concept that has been that we are applying nowadays. So it is a human, supportive, and flexible response to the fellow human beings who are suffering or distressed during or after crisis or emergencies. Like currently we are having this pandemic. Okay, so the main concept of the psychological first aid is like taking good care of oneself. I should be taking care of myself. Okay, so first one is we need to care for their immediate needs. What is the problem that they are having? Are they a requirement of anything? So what is that we need to identify, and then we need to see to that the needs are met, and then we have to protect. Okay, so any kind of risk or any kind of infection is there, any threat is there, we have to protect, and then we have to provide comfort. So comfort, how we are going to tell? Okay, like there are two ways of giving comfort. One is like we are there to help you, and sometimes we can say that you are not the only person suffering. Even there are people who are suffering much more than you. So in such way that we can comfort and support. Okay, for all the practical activities we can support them, and we need to provide information on their coping, and we have to help them to connect with the society. So there are a lot of social support services are available now, helpline services, online counseling, telephonic counseling, everything is available there. So we have to connect them with that, and we have to educate about what is the normal response. Okay, after any death or after any uh, suffering with any kind of disease. Okay, it is normal for the patient to have some kind of disturbance for some period of time, and after which he will become normal. So we have to teach them about the normal responses, because since we don't know what is the normal response, even we feel like even grieving is also a normal response, but if it is prolonged for a longer period of time, then only that creates a problem. So we need to tell them about what is a normal response, facilitate the normal response, so that they are allowed to undergo the emotional feeling, and then thereby we are helping to come out of that particular negative emotion which is affecting the individual. So what are the principles in this psychological first aid we are going to have? One is prepare. First, we need to learn about the crisis event. We have to learn about the available services and supports, and learn about what are the safety and security concerns that we need to concentrate on the individual. Then we have to look. Look is for observe for the safety, observe for people with obvious urgent basic needs, and also people with a serious distress reaction. So we have to observe this one as a healthcare professional, and we have to listen, make contact with the people who may need the support, ask about the people needs and concerns, listen to the people and help them feel calm. Most of the time, no, we need not do anything, just our physical presence and our assurance. Okay, like I am with you, if anything is there, I will help you or I will take care of you. So that assurance itself is going to give a lot of comfort to the people. So we can do that one, so that they become very calm. And link, okay, so what we have to do is we have to help people address basic needs and access to the services, and we have to help them to cope up with the problem, give information, and find out where and all social support is available, and connect them with to it. Okay, so these are all the 4 action principles that we need to follow while we are providing care for the people. And then what is the core actions that we need to take? One is initiate contact and engagement. So whenever you identify people with the problem, you encounter them and you start to identify. Then we have to ensure the safety and comfort of the patient, because after safety and comfort only, addressing other need comes. Then stabilization. So stabilization is making them stable with the current environment and gather information on current needs and concerns, providing practical assistance. Practical assistance in the sense, if they are affected with any kind of issues or problems, or they have some problem in mobilization, or they have some problem in feeding, then for those kind of things we need to assist them, and we have to connect them with the social support group, so that further they are able to lead an independent life. And important thing that we have to do in psychological first aid is providing information on coping. Okay, so once you are strengthening an individual with coping, then automatically any kind of stressful situation or any kind of distressful event, they will be able to overcome in a better manner. And also we need to link with the collaborative services. So find out in the nearby area what are the services that are available, and you collaborate them with them, link them with those services. Okay, and next is there is another traumatic factor cognitive behavior therapy. So here, this is also another important therapy that we can provide for the patient. So which happens for about 8 to 16 sessions. So there are 3 phases are there. So one is stabilization phase. Stabilization is the phase immediately following the after the infection. So first we need to give psychoeducation. Psychoeducation is addressed to their normal responses. What is the normal response? What is happening to them? What we need to do? So we have to educate them. Then relaxation. Okay. Nowadays it has become very important that people are all the time living in the fear. So what is going to happen? A future which is unstable. So what is going to happen in the future? Whether I will be able to live, or whether I will have a job, whether I can continue my education. There are a lot of queries that will be taking place within the mind of an individual. So once the mind is relaxed only, they will be able to have a better thinking. So teach them about the relaxation techniques and affect modulation, change their mood. So which is very important, because all the time if they are going to be anxious, all the time they are going to be depressed, or all the time they are going to be in a sad mood, it is very difficult for them to find a solution or to come to a normal stage. Okay, and cognitive coping. Cognitive coping is nothing but, like I used to tell that the faulty thinking leads to faulty behavior. So if you want something to be corrected, you correct your thinking process. If you have good thoughts, everything what is going to happen will be good. If you are thinking bad, whatever is going to happen will also be bad, because our good thinking, like, it attracts the energy that is there in the environment. So always make the person to have good thoughts and positive thinking. Okay, so this is what we do in the stabilization phase. And next, what we'll do is trauma narration phase, because they have underwent the trauma. The trauma will be there within them. They have unspoken fears. They have unspoken anxiety. So definitely they need to let it out. So in this trauma narration phase, we are going to ask them to let out what they felt, how they felt, what happened to them, or what they thought, and how they were dealing with that particular situation. We need to find out from them. And then the next phase we go is the integration or consolidation phase. So in this, we teach them about the various therapeutic techniques, about how to manage this trauma, and then how to overcome this one, and what coping resources that they need to use, so that they are able to overcome. And this this kind of cognitive behavior therapy, it is a lengthy session. So it again depends upon how long the person was affected with the problem, but minimum of 8 to 16 sessions are required. So each session will be lasting for about 45 minutes to 1 hour. So in this therapy, first we are going to assess, engage, and we will set the goal. And after that, we are going to stabilize and adopt the coping strategy enhancement. Like, we find out what is the risk management, how to reduce substances, what are the stabilizing effect, whether sleep hygiene is maintained or not, about coping strategies, coping with voices, and the suspiciousness. Paranoia is suspiciousness. And then we are going to share this trauma factor cognitive behavior therapy by linking them with the past trauma experiences and the current traumatic stress reactions and the psychotic symptoms. So then we are going to do with cognitive restructuring. That is, correcting our thought process will correct our mind as well as our behavior. So that is what we are going to do by means of having the trauma-related negative appraisals, voice-related voice and associated beliefs, their visions, or what kind of images they are undergoing, and if anything has happened in their childhood period. So that is also going to determine how they are going to overcome the present problem. And then we are going to do the imagery rescripting. Okay, by means of visualization, we are going to help them in relaxation process, and relieving with the cognitive restructuring and schema work. Schema is nothing but the belief system that the patient will be holding. So we are going to modify the schema. So whenever any experiences we undergo, all those experiences are converted into form of a belief system. So when we want to change something, you need to change the belief system. So when you want to believe the change system, then that can be done by means of experience only. So by making the person to undergo a good experience, we are going to correct the schema, or by means of cognitive suggestions, we can correct that one. Okay, and following that, we will be trying to prevent the relapse of the individual. And next is another, this is one problem that is associated with the substance abuse. There is one problem called as MAT. MAT is nothing but medicated assisted treatment. So here they say that certain drugs like methadone, naltrexone, and bupropion are given as a treatment part in the, like is used in the opioid use disorder. So here we are going to curb the cravings and allow them to go into for the re-entry and rehabilitation and the treatment. We will identify what is the problem that they are having, and we are going to manage the symptoms. So MAT program also we can involve them. Okay, and the virtual recovery program. So because of this COVID pandemic, everywhere we have the lockdown. So we have different online groups which are going to support the individual and which are helping them in overcoming the problem. Okay, one is Alcoholic Anonymous. So it offers online support groups. So this is the website link, and we have an Cocaine Anonymous. So for people who are cocaine addict, and then Life Ring. Okay, so Life Ring helps in the recovery process. People who have recovered from the dependence, either alcohol or drug dependence, after that how they need to live. Okay, and even we have in the rooms online recovery meetings. So this provides live discussions, like if they are in recovery of group therapy sessions, here they can have it. And Marijuana Anonymous. So this is also again related to drug. And Narcotic Anonymous. So this is for people who have the narcotic dependence, and Reddit recovery. So this is for people who are in the post-COVID period. And then Refuge recovery. So Refuge recovery provides again online support and self-management and recovery training program. So this is a SMART. This program is called a SMART. So this is an support which offers to the community people. Like after my recovery, like after this COVID pandemic, what happened and how to deal with the situations, those things and they will be discussing over here, how each individual has managed. So they can learn from each other. And the Sober City. So Sober City is for the people who want to quit the habit of alcoholism. And again, Sober Grid, Sober Stias. Sober Grid is again for the people who want to quit alcoholism. And Sober Stias is for the women community. And Sober Recovery. Okay, Sober Recovery is the program for family and friends. Okay, even when one person is there as an alcohol dependent or a substance abuse person, and automatically the family as well as friends are going to get affected. So, and they'll also be getting affected with psychological issues. So how to take care of that? So that can be done by means of this virtual recovery programs. Okay, so far we have seen about like how to manage another thing. So how we have to build resilience. Okay, coming back to the normal stage, whatever situation, stress or problem or pandemic, whatever we are going to undergo, again we have to come back to the normal state. That is what is called as resilience. So one is making connections. Okay, talk with other people. Okay, and self discovery. Identify what is good about yourself. Okay, and we have to accept and manage the change. Yes, pandemic is there. You have to undergo this process of lockdown. Okay, and after that, okay, what am I going to do? What kind of changes I need to make in my lifestyle? Okay, and keep things in the perspective. Okay, have a longer perspective and take decisive actions. Whatever you are going to do, okay, everything should be based upon your own decision, because so that you are not going to blame the other individual. And even though this pandemic is there, this is not going to be there permanently. It will also go on. You need to move on. Okay, you need to move forward. So what am I going to do? So whenever you had some goals or something like that, you concentrate on your goals. So this lockdown is not going to cut down or shrink your goals. Rather, you can utilize this period for developing strategies so that you can achieve your goal. and nurturing self-esteem. So this is very important. Okay, you protect yourself. Don't expect that someone has to come and help you. You can help yourself. You are the better person to help yourself. Always maintain hope and positivity. Okay, so don't get dejected or feel negative. I don't think that okay, why I should live, why I have to do this, why I have to do that, because we don't know tomorrow I may live or tomorrow I may die. So don't have all those feelings. Okay, uh, today you are alive. Okay, thank God, and keep that positive feeling and continue to move on. Okay, and taking care of oneself. So this is very, very important, because we will give a lot of advices to other people, but we neglect our own care. And we cook a lot of delicious food to other people, but we never prepare some kind of delicious food and eat for ourselves. So no, it's not so. No. Taking care of other people are important, but at the same time, taking care of yourself is very, very important. Okay, because you will be the best person to take care of yourself instead of depending on the other individual. Okay, and seeing crisis as surmountable problem. Don't feel like okay, this is a very big problem. Okay, in our life, in our various stages of our growth and development, we could have encountered n number of problems, and all the problems we have handled in a very effective manner, and we have overcome, and we have come to this stage. Okay, and problems will be there. Definitely we are going to find a solution, and we will overcome the problem. Okay, so that is what will happen every time. So don't feel like something is a very big problem, and you are under that. Don't feel that one. So see that every problem will pass by. Okay, and always whenever there happens a problem, looking for the solution instead of telling that this problem happened, why happened, this happened, that happened, she is responsible, that is responsible. Don't ponder over the problem. Instead, look into the solution for the problem, which is going to help you. Okay. So next is breathing technique. So very one of the important easy way to relax ourselves. Okay, and not only that, not only for relaxation, it has also got various other effects on our physical health also. So the pursed lip breathing and diaphragmatic breathing. So all of you will be knowing about that. Okay, inhaling through the pursed lip breathing is inhaling through the nose and exhaling through the mouth, and diaphragmatic breathing. So it is called as belly breathing. So follow these techniques so that you are able to relax yourself, and there is also an increased oxygen supply to the brain whenever we have this follow this breathing techniques, so that we have a very clear thinking and our brain is functioning in a proper manner and not suffering with the problem of hypoxia. And progressive muscle relaxation. So okay, whenever possible, take 5 minutes and sit in a chair. Okay, and then you shrink your face. Okay, and then you try to relax it. Okay, same way you do it for each part of your body. Then do for your arms, do for your shoulders, do for your chest, do for your abdomen, then do for your back, then your thighs, then your legs. Okay, and then take a breathe in and breathe out. Okay, breathe in through the mouth and breathe out through the mouth. So this is one way, like where you can relax up your muscles. So this is only hardly going to take you're going to take about 5 minutes of time. So using that 5 minutes of time, we can do this progressive muscle relaxation, a very simple technique. This is going to relax our mind, calm ourselves, and stretching. Okay, so because of lockdown, the activity is restricted to a lot. Okay, and we always find the reason whenever we think that we need to do some exercises. We find reasons for not doing the exercises, and now is the best time. We say that no, outside house I cannot go. Then what you can do is be at your home itself and you can do these stretching exercises. Okay, so these stretching exercises like kneeling lung stretch and the piriformis muscle stretch, lateral fusion, chair hamstring, and back flexion stretch. All these are simple stretching exercises which can give a relief from the stress what you are undergoing because of immobility or inactivity. And body scan meditation. So this is very important because whenever we are becoming tensed or stressed, okay, our body, okay, we are accumulating some kind of negative energy in your body. So what we need to do is we need to scan our body, okay, and find out, okay, which are all the part of my body are having some kind of tension, or there is some kind of hold is there, then you take 10 deep breaths and try to focus the sensation in your body in the following order. Take 10 deep breaths to relax, and then concentrate first on your head, then face, neck, your shoulders, upper back, lower back, abdomen, your pelvis, then upper legs, lower leg, and feet. Okay, so again, you can repeat this one again in an order, and you can find out which part of your body is having a tensed reaction. So again, by means of your breathing exercises, you can relax that one. And what are the benefits by means of having this body scan meditation? It is going to help you to have a better sleep. It is going to relieve you from anxiety and stress. You are aware about what is taking place in your body, and that is going to boost your self-compassion. And it will also be reducing the pain that we are encountering in our body, and reduce cravings. Sometimes when we decide to quit some habit, then immediately we always think about that. No, when we say that we have to take less sugar, then immediately we always think about sugar only. So body scan meditation is another very relaxation technique you can follow, and practicing mindfulness. Okay, so very important one. So mindfulness is be present at the moment. Don't allow your thought process to go to the past. Don't allow your thought process to go to the future. So take a seat, find a place to sit where you can feel calm and quiet. Then you sit a time limit like 5 to 10 minutes, and notice your body. Okay, so feel your breath. Just observe your breath. You need not do anything. So if your thought is going to go somewhere, let it go. If it is going from London to Australia, or wherever, whichever country or whichever place it wants to go, let it wander. Okay, again it will come back to you after some time. Simply focus on your breathing. Okay, don't judge about anything. Don't try to control, why my mind is wandering. Don't start your thinking process. Just sit in a calm place and observe your breath, and just see what is happening to your thought process. So that also will be helping you to relax yourself. And definitely diet plays a very important role. Take a well balanced diet, inclusive of your carbohydrate, protein, fat, vitamins and minerals, lot of vegetables and fruits. And hydration, it is very essential, because good food is going to give you good health. It doesn't mean that consuming large amount of food, or junk foods or unhealthy foods. So eat a balanced diet, which is comprising of lot of fruits and vegetables, and with the protein. So during this period, and I'm not going to stress more on this, because yesterday you had a session on this. And mindful eating. So whenever we are eating, have a mindful eating. We have to cook and eat in a good mood. Whenever you are eating something, feel the taste of the food. You can listen to the soft music and eat your favorite food at last, because many of the time, no, we try to eat food which we like the most first, because eat the food which you don't like first, and then eat the favorite food at the last, so that you can enjoy, relish, and don't do multitasking when you're most of us have the habit of watching the TV and eating, and we never realize that what is the texture of the food, what is the taste of the food, what is the aroma of the food. Nothing we don't mind. So don't involve in any other activity. So respect your body and health. Drink more water. Don't be in a hurry to eat, because some of the people I have seen that they will be eating within 5 minutes. So within 5 minutes, how to eat? Okay, what you would have relished about the food, and even proper chewing also you would have not done. Okay, don't do that. Okay, allow ample of time. Okay, I have 20 to 30 minutes, chew the food, enjoy the food, and then you. Mindful eating is very important to maintain health. Even many research, they have identified that when people are eating mindfully, the frequency of getting them affected with illness are very minimal. And even this system our ancestors have followed. They say, no, even in my grandmother, they say during eating the food, you should not talk. Concentrate on the food and eat. Don't argue, like that they used to tell. So mindful eating is a very important technique. And healthy sleep. Okay, so sleep is very important. Follow sleep hygiene techniques. Okay, before going to bed, don't go in for your social medias. Okay, don't watch TV, don't watch a cell phone. So at least for 1 hour, okay, you should keep away your electronic gadgets. Sleep in silence and dark. Don't eat too much of food. So have your dinner before like by 7 o'clock, and do not smoke or use alcohol. And you can take a walk before going to bed, and not to take any caffeinated drinks. Okay, sleep on a firm and comfortable position, and adjust the room temperature. Go to bed at the same time and wake up at the same time. Okay, so circadian rhythm we have to maintain, and don't keep any electronic gadgets near to your head. But we all have the habit, right? We keep the phone under our pillow, and the first thing, the last thing we see before sleep is our phone, and first thing we see after the sleep is our phone only. So don't do that one. Don't watch TV or computer games before going to bed, and don't focus too much on insomnia. So if you follow all these things, you're going to have a healthy sleeps and healthy life, and always be positive. So this is very, very important. Whatever you're going to do, okay, think positive and be positive. So this is going to do wonders in our life. So always have a positive thinking. Always think that yeah, all negative things will pass by, okay, and you are able to do everything. Today you are alive, and you will be able to achieve a lot of things in your life. Always be positive instead of clinging on to the negative, or clinging on to the problems. It is not going to give you a proper solution. So be positive in whatever you do. Be positive in your thinking, be positive in your activities, be positive in your feelings also, so that we are able to have a healthy life. Okay, so these are all some of the references I have used. If you have any questions, you can ask me now. There are some 2 minutes are left. I can answer that. Okay, and thank you very much for your patient listening. Thank you.
Thank you, ma'am. Attendees can post your questions in the chat column.
Okay, and I thank the organizers and Dr. Indra Madam, our principal, for giving me this opportunity to do the presentation in this international conference. Thank you.
Thank you for your wonderful presentation, ma'am. I think till now there is no questions posted in the chat column.
Yeah.
Thank you. Now let us have a break of 15 minutes. We will resume the session after that. Meanwhile, I just want to give an important announcement. As a part of this conference, we had conducted an e-poster presentation competition. Now we are going to play those posters for all the attendees for the review purpose. Valuation of these posters are completed and the winners will be announced during the valedictory session. All the poster presenters will be honored with a participation certificate and winners with first to third prize. Stay connected. We are going to display the posters. Yes. We'll restart our session with the next speaker. Let me introduce Dr. Duke, Senior Lecturer, Lincoln University College, Malaysia. Sir started his nursing career from Trinity University of Asia, Philippines in Bachelor of Science in Nursing, Post-Basic Certificate in Teaching Methodology, Lincoln University College, Malaysia, Masters of Science from University of Hertfordshire, UK, and Doctor of Philosophy from Lincoln University College, Malaysia. Sir is having more than 20 years of experience in different healthcare settings, such as National Center for Mental Health, Philippines, Philippine General Hospital, Manila, and Lincoln University College, Malaysia. He is an expert in emergency nursing too.
Smita, I think audience are unable to hear, I think. Please.
Just unmute, ma'am. Can you hear me now? Am I audible?
Yes, yes.
With this short introduction, I am inviting Dr. Duke to present his topic. Dr. Duke? Welcome, sir. You can start with your session.
Good morning, everyone. Can you hear me?
Yes, sir. We can hear you.
All right, good morning. So I hope everyone can hear me. I'm from Lincoln University College. My name is Regidor III Dioso, and I'm from the Faculty of Nursing. And the title of my topic for today is Pulmonary Sequelae on among patients with COVID-19. Regidor III Dioso, and I'm from the Faculty of Nursing. And so one of the aims of this discussion for today is to describe pulmonary sequelae among patients with COVID-19, discuss the management of COVID-19, and discuss the primary and psychological roles of nurses. Before we proceed with the main discussion, I would like to show you a video of the discussion for today. Just an introduction. So the video is showing about dry cough, shortness of breath, phlegm production, and the percentage of laboratory confirmed cases of COVID-19. So the video is showing about dry cough, shortness. All right, so pulmonary sequelae are divided into long term and short terms. And the long term pulmonary sequelae are mostly acute respiratory distress syndromes or ARDS, severe acute respiratory syndromes or SARS, and Middle East respiratory syndromes or MERS. The short-term COVID pulmonary effects are asthma, fibrosis, pulmonary tuberculosis, and pneumonia. So what do we mean by sequelae? Sequelae is the effect of a current condition that occurred before. So the current condition is COVID, and what is the effects on pulmonary following COVID-19? These are the features of pulmonary sequelae. They can have fever, cough, fatigue, anorexia, shortness of breath, myalgia, and others like gastrointestinal tract problems and headaches. Headaches because of decreased oxygenation that's going to the brain, and they will have a lot of intracranial pressure that can be experienced. So other signs and symptoms, according to one of the research in PubMeds, are also fever, but there is dyspnea, expectoration, pharyngalgia, diarrhea, nausea and dizziness, and vomiting and abdominal pain. What are the risk factors that can be experienced? These are the adults between 2.5 to 15% of people still symptomatic of greater than 22 years old, and factors that appear to be associated with greater risk of suffering from COVID-19, pulmonary sequelae, and this appears to be increasing age, excess weight, or obesity, and female gender, asthma, multiple symptoms and presentation, disabled personnels, or the disabilities such as those with congenital abnormalities. Patients may have had a positive COVID-19 test, swab test, and children that are in the age of 12 to 16 years old and 2 to 11 years old are also prone to have pulmonary sequelae. So simple disease process of pulmonary sequelae is that the COVID is infecting the weak lungs and it will give you a pulmonary sequelae. Let's watch the video for a more clearer presentation of the disease process. So this is how COVID-19 works. It goes inside the lungs in the air-filled sacs or the alveoli. They can also transfer by droplet nuclei. Inflammation can occur in the fluid-filled alveoli sacs, and there will be lung damages. So the ACE2 inhibitors are the ones that increases the inflammation process of the lungs, and that is why we can experience other symptoms or other diseases that can come about as an effect of COVID-19 infection. And radiologically, it will be diagnosed with lung lesions with high resolution computerized tomography scan and chest x-ray. So these are the symptom distress. Physical health changes at 3 to 6 months after symptomatic COVID-19. And the big three physical symptoms are the fatigue, chest and joint pain, fever, and breathlessness. So what are the other symptoms that we can experience? Fever, of course, cough, sore throat, that can come about with the additional three from the three physical symptoms. These are the other clinical presentations. It can be divided into mild, severe, and critical diseases. So one of these clinical presentation, 80% is reported to be mild pneumonia, while greater than 50% of the lung involvement imaging within 24 to 48 hours are the dyspnea and hypoxia. These are the severe diseases. And the critical diseases are examples are respiratory failure, respiratory shock, or multi-organ dysfunction, reported in 5%. And these complications mainly in elderly and those with other health problems. So the phases of COVID-19 in general have the acute and ongoing symptomatic and the post-COVID-19 syndrome. The acute signs and symptoms of COVID-19 is up to 4 weeks, while the ongoing symptomatic COVID-19 signs and symptoms are from 4 to 12 weeks. The signs and symptoms that develop during or after an infection consistent with COVID-19 continue for more than 12 weeks and are not explained by an alternative diagnosis. The pulmonary sequelae of COVID-19 patients have been commonly used to describe signs and symptoms that continue to develop after COVID-19, and it includes both ongoing symptomatic COVID-19 from 4 to 12 weeks and post-COVID-19 syndrome 12 weeks or more. So what are the most common symptoms? They can be multiple, varied, and fluctuating over time. For example, fatigue, general and post-exertional fatigue, respiratory symptoms, persistent shortness of breath, 81%, and persistent cough. The musculoskeletal, including pain and muscle fatigue, and neurological, including headache, neurocognitive disorder, and dizziness. The cardiovascular can have palpitations, arrhythmia, postural tachycardia syndromes, and the gastrointestinal can have nausea, bowel changes, and indigestions. While the general can be persistent fever, chest pain, rashes, insomnia, and the metabolic can be worsening diabetes and metabolic diseases. The psychiatric or psychological common signs and symptoms are sleep disorders, stress, and depression, and mood changes. So the symptoms can be multiple and varied. It can have both respiratory, neurological, and general or metabolic and psychiatrical or psychological. So what are the investigation for pulmonary sequelae among COVID-19 cases? One of the investigation is the chest x-ray. This is the famous investigation which shows the resolution of mostly fluid-filled air sacs. And this is an example of a male that is intubated within 8 hours of admission of COVID-19. And the resolution of 12 weeks, there are still more vessels that are manifesting through the chest x-ray. The other investigations can have pulmonary function tests and high resolution computerized tomographies, and they have abnormalities as well. And these are the systematic review of the pulmonary function test and high resolution computerized tomography findings done from China, Canada, Netherlands, and Malaysia. They are more into pulmonary function tests and high-resolution computerized tomography to determine whether there are pulmonary sequelae that are experienced by cases of COVID-19 patients. One of the investigation, in addition to pulmonary function tests and high-resolution computerized tomography, are xenon scans. There are hyperpolarized xenon with magnetic resonance imaging to identify oxygen diffusion in the alveoli. So the sputum and swab test is also used to test to determine whether there are other pulmonary sequelae. They use mast cell activation syndrome or sputum test for those with cough, wheeze, shortness of breath, lung disease to confirm asthma. Tuberculosis is also diagnosed with sputum and swab test to confirm if there is a recurring COVID-19 positivity of infection. So asthma will be there and tuberculosis will be there. Those are the famous pulmonary sequelae. So what are the primary role of nurses on pulmonary sequelae now that we have tried to investigate and determine the signs and symptoms in the pathway? We're going to look at our role as nurses for patients with pulmonary sequelae. So number one is referral. Refer the findings to the right specialists. It's nice to have collaborations and partnership with other healthcare professionals that are specialists on the pulmonary sequelae that has been determined through those investigations. Holistic person-centered care. These are the performance of a comprehensive clinical history and examination. For example, physical examination, cognitive examination, psychological examination, psychiatric symptoms examination, as well as functional abilities. So we have to examine the activities of daily living of all the cases of COVID-19 that has been experienced and they're now undergoing pulmonary sequelae. Screening questions can be also asked based on the history, whether they have familiar history of diabetes or any congenital anomalies that can be transferred. Exclude other pathologies such as cancer, massive surgery, heart failure, anemia, uncontrolled diabetes. You have to ask them or get in more investigation to exclude those pathological abnormalities. Signpost to appropriate resources such as government online resources. See what the government is offering to pulmonary sequelae. Financial social services can also be a part of it because the sequelae can be more than 3 to 6 months. It can last for 12 months and financial support will always be there. I mean, problems will always be there financially to provide them with the medications and treatments. Peer group support. They must have the peers support, especially recommended as family support programs. But if they don't have any other family, they can have the peer support group. Health and well-being navigators, which are found online. The health and well-being, it can be online. Assess the phases, whether they are in acute, ongoing symptomatic, or post. So the primary care pathway for nurses, the pathway is to check the history first and then examine, investigate, and then refer. So these are the pathways. So you must have the history before you can do an examination. For example, blood tests, recommend for blood tests, recommend for O2 saturations and more examinations regarding the respiratory diseases. And physical examination is independently done. So you can check for lung murmurs, lung edemas, heart murmurs, and other adventitious sounds of the lungs. Investigation can be chest x-ray. This is the famous investigation for pulmonary sequelae. Lung scans such as xenon ultrasounds, echocardiograms, and tomographies. Sputum, mast cell, or swab cell for more further investigations of if there is an ongoing positive COVID-19 or recurring positive COVID-19, mast cell for asthma, blood mast cells, FBC, full blood count, liver function test, cancer cells test, ferritin test, and COVID blood tests. Referral to COVID clinics if other causes exclude and admit anytime post-acute illness will be the last pathway as primary care. So if you are a nurse in the triage, these are your responsibility is to divide them into color codes, whether they're green, yellow, and red. So as you know that emergency triage nursing is divided into color codes. So how do we determine green patients in the triaging? They are asymptomatic, COVID positive, or mild symptoms, no radiological changes. What do? We give safety netting advice, and we refer to physicians if persistent for more than 6 weeks or progressive symptoms of cough, breathlessness, chest pain, or hemoptysis, or development of new respiratory symptoms. The primary care virtual clinic health promotion includes the mental health of the client, exercise, fatigue, nutrition, respiratory symptoms that must be advised when they go back home. For yellow category of patients, these are the mild to moderate COVID pneumonitis, most probably pneumonitis. The radiological evidence of COVID infection will be there, and absence of severe fatigue. Usually 12 to 16 years old are placed in this category, which have mild pneumonitis, and give safety netting advice, referral into secondary care chest clinic if persistent radiological change symptoms are concerned, and if chest x-ray are normal, significant improvement for discharge may be recommended. The primary care virtual clinic, or when they don't want to go to the hospital because some countries have their own virtual clinic, chest x-ray before discharge are requested on discharge by hospital team when they were having a COVID-19. And the red patient's severe COVID pneumonitis is determined by critical admission. So the red patients came from critical admission, then they go to emergency pulmonary surgery, or they have been intubated with greater than 35% oxygen with a tidal volume of 500 liters per minute, backup rate 6 liters per minute, and PET 5. So these are the mechanical ventilation setup. And if they go back to emergency department having these history, they are categorized in the red zone. Other clinical concerns, especially pregnancies, are also categorized in the red zone. Referral to respiratory medicine must be done, and referral to obstetricians if there is positive in pregnancy. So the algorithm for pulmonary sequelae general nursing care algorithm looks at nebulization with normal saline, maintaining occlusive dressing. If there are any pneumothorax that has been done, or puncture or thoracostomy that has been done, occlusive dressing must be maintained or redone, and suctioning and chest pulmonophysiotherapy. So the first algorithm, if cannot be relieved with primary interventions such as nebulization, suctioning, chest pulmonophysiotherapy, or maintaining occlusive dressing. If the answer is no, it cannot be relieved. If the answer is no, it can be relieved, then chest x-ray will be done and the discharge will be recommended with health education leaflets or electronic soft copy of instructions for maintaining the healthy lungs. If the answer is yes, it cannot be relieved with primary interventions, and the chest x-ray and CT scan shows classical probable changes consistent with COVID-19 and confirmed presumed COVID-19, then the persistent more than 6 weeks or worsening or new onset respiratory symptoms is asked. Whether there is cough, breathlessness, chest pain, or hemoptysis is also asked in the history taking. If there is a yes, then you need to perform emergency triage system. If the answer is no, the patient is considered symptomatic, but they can take home drug medication treatments. Consider discharge and rehabilitation program at home. They don't need to be confined. So if the emergency confinement shows that it has cough, breathlessness, chest pain, and hemoptysis, we have to perform emergency triage, looking at yellow category or red zone category, or both yellow and red zone, which is undetermined whether it's a yellow or red zone. So if it is a determined yellow zone, You have to categorize whether it's mild, moderate COVID pneumonitis, or and if it is determined as mild or moderate COVID pneumonitis, then we can see the age group or pregnancy if it is having minor age or children or having pregnancies. So we have to repeat the swab test or sputum or chest x-ray and then request previous chest x-ray report review by referring consultant. And if it's on the red zone, the severe COVID pneumonitis will be transferred to the ICU or OR admission if there are emergency operations that needs to be done. For example, thoracostomy or tracheostomy or thoracotomy will have to assess psychosocial need and parental consents if it is minor age. Confined with COVID precautions must be done after the operations are a successful operation. Then if it is on the red zone or yellow zone undetermined, we can confine with COVID precaution immediately without undergoing ICU or OR admission. So on the yellow zone, if normal improved patient, you can discharge. If persistent symptoms, we can refer again to chest COVID clinic for clinical assessment or quarantine if there are significant chest x-ray changes. On the red zone, if it is normal or improved after confinement, then they can be discharged. If there are still persistent symptoms or chest x-ray, they can have the isolation ward just to make sure that they will not spread the disease. Discharge after quarantine and rehab. Even though they are discharged, they will still be quarantined and undergo rehabilitation. So what are the independent nursing care? Early days advice on self-help will be the repeat self-care routines. You have to advise them on repeat self-care routines. Maintain healthy pregnancies, gentle activity, rest and sleep, hydration and nutrition. For 10 years old, advise the parents. And the active intervention 6 weeks, you have to reassure acceptance of good and bad days, rest and sleep, routine activity, hydration and nutrition. And for 12 to 16 years old, we can inform parental consent for active interventions. Advise 6 weeks, follow up. After 6 weeks, we must advise them to follow up. So what are the advices? Energy conservation. They should plan and prioritize and pace themselves. We cannot give them more stress. And rest and gentle activity with limitations. Delay return to work for pregnancies. And for 12 to 16 years old, include the parents. So what are the advices? 3 to 6 months follow-up. First is to rest and repeat self-care routines. Encourage functional physical activity and exercise. Avoid stressful situations and refer to specialist surveys. For 12 to 16 years old, involve the parents on the advising. The outpatient care path, if you are an outpatient care nurse or if you're nurses in the clinics, so the roles is, this is the algorithm for the roles. First, you check if there are no symptoms, if there are chest x-ray or CT scan resolution, and there are no symptoms. Check for the vital signs, mild fibrosis test, or await for high-resolution computerized tomography if simple computerized tomography is not enough to detect any abnormalities or any pulmonary sequelae. So if there is a symptom called shortness of breath, chest x-ray is still done, sputum is still done, test for fibrosis is still done, but it is inclusive of pulmonary function test. If there is a positive swab that has been confirmed, then they will be confined inpatiently, not as outpatient or in the clinic. So the COVID clinic referral, if the chest x-ray is not cleared and or the patient has ongoing respiratory symptoms, at 12 weeks, we must consider pulmonary function test, a walk test with assessment of oxygen saturation, echocardiography, sputum samples, purified protein derivative tests for pulmonary tuberculosis, and repeat pulmonary x-ray for clinics. If the nurse is doing telecommunication care, because some interventions require nurses to do telecommunications so that they will not need to go to the hospital, since the hospital is very prone to acquiring more infectious diseases. So the nurse should know if there are breathlessness complaints. Breathing and resting recovery positions to ease effort of breathing. Uh, you have to give this as an advice for breathlessness complaints. Nose and diaphragmatic breathing, pursed lip breathing rhythm. So advise them on doing pursed lip breathing. This is how to do a pursed lip. Breathe in through the nose and breathe out, pursing your lips. You purse your lips and then you breathe out. That's how you should advise them on telecommunications. Teach the breathing through paper bag, usually for 10 to 16 years old callers. They can use the paper bag if it's an asthma attack. And relaxation or meditation for pregnancies is usually having Brixton Hicks contraction. They need to have a relaxation or meditation for pregnancies if they are stressed out with their cough. Blow as you go, pacing your breathing with activity is also an advice when doing a telecommunication for breathlessness. So when you pace, you blow your exhale. For cough complaints, may persist due to increased sensitivity throat and upper airways. So the nose breathing or the nose breath must be moistened, filtered with air, usually for 10 to 16 years old callers. Sips of water is also recommended. Sips of water for cough complaints. They can suck some sweets or some candies for children. Relaxed breathing postures such as forward lean sitting, so they can sit and they forward themselves leaning down when they have cough complaints. Relaxed breathing posture and relaxation meditation for pregnancies if they have cough complaints, because it can induce a Brixton Hicks contraction. Rhythmic cycles of breathing can also be recommended. They hold their breath and then stop breathing for a while, and then they can release their breath. This is maintaining the cough reflex. This is removing the cough reflex, because sometimes they keep on coughing since they are having the reflex already. It's not really because they cannot breathe, but it's just a cough reflex. So this is what we do for coughing reflex, rhythmic cycle of holding the breath and then releasing it. Post-COVID breathlessness of inpatient hospital nurses. So if you're a hospital nurse, inpatient, these are your roles. Variable from person to person. They are general health, hospitalized with COVID infection, pathological changes to lung tissues, deconditioning, and raised BMIs are the variable risk factors for pulmonary sequelae. So consider patient baseline vital signs, especially the fetal heart rate of pregnancies. Secretions are needed for chest clearance, usually for 10 to 16 years old with trach. Oxygen saturations, desaturation on exertion, and not always synonymous with shortness of breath. And by 6 weeks post-infection, it might show substantial improvement, but can take 3 to 6 months with fully resolution. These are the responsibilities of nurses inpatiently. For outpatient or clinic nurses, for breathlessness management, because usually patients or clients will go to outpatient or clinics because they are experiencing breathlessness. So the management will start in positioning, instruct upright breathing, and then breathing control. It has to be a comfortable position, relaxed shoulder, hands on tummy and chest for pregnancies, and steady breaths in through the nose. Feel the tummy rise. Relax breathing in inhalation through the nose and breathe out through the mouth. So these are the as you can see, there's a four-way doing these rectangular breathing control. Breathe out, breathe in, breathe out, breathe in. Through the nose, in through the nose, and out through the mouth. Focus on extending the breathing out. So in order for you to control your breathlessness, focus on extending your breathing out. Once you breathe in, inhale very deep, and then let them breathe out longer than what they need to expand. This will expand the lungs and help the diaphragm exercise its expansion or contraction. Blow as you go. The main effort is on breathing out, usually for 10 to 16 years old, for those who are experiencing asthma. Pacing is slowing down, break tasks down, regular short breaks as opposed to fewer prolonged breaks, especially for pregnancies. Other hints and tips are cool wet cloths on cheek and nose because they can induce a vasoconstriction for cooling down the the stress that's experienced. Fresh air, relaxation, mindfulness encourage staying calm or controlling anxiety. So the nurses in primary care services or practitioners, uh, they if there are nurse practitioners, they have to look at the weeks. If it is 1 to 2 weeks or 3 weeks or 3 to 4 weeks or 5 weeks of pulmonary sequelae, uh, the pre-COVID baseline compared to post-COVID physical ability and breathlessness recommendation is no change or slight decline in 1 to 2 weeks. Continue on with the treatment, there will be no change. Within 3 weeks, there will be slight or moderate decline, and within 3 to 4 weeks, there will be moderate decline. For 5 weeks, there will be this severe decline. So what are the interventions within 1 to 2 weeks? Generally, online resources and self-help is recommended. They can look for My COVID Recovery online or parental advice for 10 to 16 years old. The parents can look at the My COVID online general resources of self-help. For 3 weeks, the targeted information provision is positions of ease, breathing control, pursed lip breathing, plan pace, and prioritize. Stay active or get online for My COVID Recovery videos to learn more on breathing control and positions of ease or pursed lip breathing. For 3 to 4 weeks of moderate decline, an intervention is pulmonary rehabilitation or hospital confinement. So therefore, the nurse practitioners will need to give them a recommendation of confinement. Usually for 10 to 16 years old, they need parental advices for confinements if there are pulmonary sequelae such as experiencing a pulmonary tuberculosis or asthma. For severe decline, specialist or referral or hospital admission, especially for pregnancies, this is at 20th to 30th weeks of gestation. A specialist is always recommended with severe cases of 5 weeks experiencing pulmonary sequelae. If you're a public health nurse, therefore, health promotion is necessary. Home visits is necessary for distribution of leaflets, and ask them for the leaflets if they have breathlessness. Home visits and teaching them to do exercises. These are public health nurses going on home visits. They can give them brochures for breathing techniques and teaching them at home. Family support is also necessary for rehabilitation of self-management after COVID-19 related illnesses, after pulmonary sequelae are experienced. For the research campaigns, there are a lot of nurse researchers who requires departments and institutions of how to cope with being short of breath or breathing exercises. These are one of the nursing research campaigns that is ongoing for pulmonary sequelae. Post-ICU nursing care, after being admitted as COVID-19, there comes a time that you will experience pulmonary sequelae because this is the after you've experienced COVID-19, sequelae will always be experienced as an effect of COVID-19. So assessment on post-ICU's intensive care syndrome, it can be anywhere. It can be neonatal, pediatric ICUs, or adult ICUs, or coronary care unit. So the acquired weakness in the ICU will be experienced, and physiotherapy is recommended. So ICUAW requires physiotherapy for fatigues and muscular degenerations. And pediatric ICU for 6 to 16 years old includes portable suction demo for the parents, just in case there will be experiencing cystic fibrosis or any form of um, secretions that will come about after ICU experiencing. Other ICU experiences such as post-intubation, because in the ICU they can be intubated when they have COVID-19, or they have post-catheterization problems such as tracheostomy catheters or thoracostomy catheters that has been experienced, and they get some occlusive dressings. They require nebulization demonstration. They need nebulization after ICU admission. Specialist rehabilitation for tracheostomy care, especially if they have voice problems, or they have problems with speaking, they can have rehabilitation from specialists after COVID-19 in intensive care admission. So the discharge plans in hospital for nurses as health education, what is your role? Your role is to demonstrate and demonstrate for tracheostomy care if there are tracheostomies that has been done in the hospital. Report on identified symptoms such as deconditioning from intubation. It's very difficult to regain back your voice after being intubated. Breathlessness will always be experienced post-intubation, and the psychological health. Wound dressing demo, because they need to dress their wound if they have experienced tracheostomy, if they have experienced thoracostomy or thoracotomy surgical procedure. You have to demonstrate to them how to do the occlusive dressings, or how to do dressings, and return demonstrate for post-thoracotomy wound dressing occlusively, because the occlusive dressing requires special um, occlusion such as KY jellies, and these require return demonstration so that the patient or the client or the relatives will have an accurate demonstration when they go back home. They won't have any errors on doing the dressing on themselves. Referral to signposting to self-help support such as your COVID recovery. This is a website so they can learn more on their activities of daily living. If there are no other specialists available, they can just watch the video and learn it themselves. The family advice for family support system requires self-help web pages and reassurance of energy conservation, nutrition, and sleep. These are the websites for those families who needs more knowledge on how to do self-help web pages. Emphasize on some physical symptoms such as anxiety, because anxiety can also occur post-COVID-19 sequelae, especially on pulmonary. Palpitations can also be experienced, feeling of shortness of breath, poor sleep, delayed return to normal function will also be experienced. So emphasize on those physical symptoms so that they will not have any problems of dealing with it. To learn more, you can have the family click on these websites, and they can learn more on their self-help. Patients and convalescents, you have to reassure them and give an individual permission to convalescence, such as sleep, convalescence in sleep, convalescence in diet, and convalescence on post-tracheostomy and post-thoracostomy and post-intubation rehabilitation. There are websites on how to have a good sleep after experiencing COVID-19 with pulmonary sequelae, and diets on how to improve your diet and what are the necessary diets that are recommended post COVID-19 sequelae. Activities to the family must be advised as well. They have to avoid encouraging physical activity as a remedy in the early months, and activity should be limited to normal activities of daily living after more than 1 month. During the early months, there will be less activity but complete bed rest, and greater emphasis on function, rest, and diet after 3 months to 6 months of recovery stage. So expected recovery, what is your expected recovery? You have to advise the family on the expected recovery. Within 4 weeks, there will be reduction muscle aches, and chest pain will still be experienced if coughing persists or breathlessness persists. Sputum production will always be there if there is cystic fibrosis or pulmonary tuberculosis. Within 6 weeks, cough and breathlessness substantially will be reduced. Within 3 months, for children, fatigue may persist because of muscle wasting, because the drugs can also, especially uh, chloroquine or hydrochloroquines, can have an effect of muscle wasting. So fatigue may be experienced and it may persist. Within 3 months for adults, unresolved signs and symptoms consistent with post-COVID syndromes can also be resolved within 3 months. Within 6 months, resolution of symptoms unless complications from recovery from COVID-19 will be experiencing, and a family must be advised on that unless complications will occur. In addition to the physical or physiologic care or other independent treatments, there will be psychological care as a responsibility for nurses recovering from COVID-19 pulmonary sequelae. So generally, the nursing care must have a prevalence of psychological difficulties. Family milieu therapy is necessary for psychological care. We need to involve the families to give familiar support. It's a milieu therapy where they gather together as a family, because during the first 3 months, during the first few months, or during the first month of recovery from COVID-19, they must have complete rests, lesser activities of daily living. They can be stressed out, they can be depressed, and family milieu therapy is important for them to have. Milieu therapy means gathering together as a group and doing activities as a group. Vulnerable group therapy, they can have vulnerable group therapy after 3 months where they can go out and find help as a group, because having individual therapy is lesser effective than the group therapy after COVID-19 depression or stress. Online good practice guidelines of health education is also necessary for self-help. Resource leaflets distribution campaigns so that they will not have any anxiety on what to do, especially if they don't have any means of calling the hospital. They can have leaflets on their own, reading on their own, so that they can have their own knowledge on how to deal with their breathlessness or coughing. Counseling service provisions is also recommended for psychological help, especially if the stress or depression could not be relieved by family milieu therapy or vulnerable group therapy. Telecommunications counseling is the recommended one because of social distancing and physical distancing, or if sometimes you're locked down. Now in Malaysia we are locked down, so there will be no face-to-face contact. Only telecommunications counseling is recommended. So if they call the nurses, communications on telephones will be recommended. That includes counseling advices. So the telecommunication counseling will be recommended, but you must do it having open-ended questions. So as a nurse, you must explore the patient's anxiety and depression by giving open-ended questions. Attempt to establish rapport, especially for child callers. You must know that it is not a prank call, or they're not calling to just make a joke of it. So attempt to establish rapport before you conclude that it is a pulmonary sequelae. Active listening in positive regard. Make sure that you actively listen, and make sure that you give a positive feedback that is not threatening and not depressing or non-judgmental. Explore problems. You must explore the problems of panic, or there should be poor sleep, explore more, or flashbacks, or frightened to go out. These are the explorations that you need to do when patients call you for telecommunications. Explore the ICE ideas, concerns, and expectations. You must know their ideas, their concerns, and their expectations. Try to explore more instead of giving advices on telecommunications for counseling. Assess severity of symptoms such as psychological experiences, because the severity of the symptoms is based on the months of their experience of pulmonary sequelae after COVID-19. So assess psychological risk. This is the suicide or mental psychotic attacks. If there are suicide risks, then they need more help with regards to referral. You can call some ambulance to go and check them for psychological suicidal risks or mental psychotic attacks. Reflection and summaries. Repeat the instruction. Have them repeat the instruction, because after you have given them instructions on telecommunications, you must know that they have received or absorbed the message, or they have learned or reflected on the message that you're trying to give. So repeat the instruction. Have them repeat the instruction. Discuss follow-up appointment every 4 months. Referral to social service for financial support, or just follow-up appointment for your clinic, to your clinic, and have them go back to your clinic for follow-ups. Other management, such as reassurance of pulmonary effects after viral infection, is also a psychological intervention. Motivate gentle activity with self-assessed limitation. Remember that limitations are there, and activities should not be too much. Gentle activities motivate them, such as brushing their teeth, hygiene, personal hygiene, genital hygiene, um, taking a shower, taking a bath. Those are gentle activities. Not so much activities such as exercise or massive weightlifting or walking or going back to work. Rest and sleep is very important after COVID-19, because you do not want it to become psychologically stressful, leading to anxiety. Hydration and nutrition will relieve anxiety and psychological effect, because the more oxygenated your brains are, the easier it rests. The rest and sleep can easily be acquired if you are hydrated. Nutrition, usually for pediatrics ages 7 to 17 years old, is very important because of muscle wasting after treatments, and you do not want them to have physical maldevelopments or underdevelopments. Patient information leaflet explanation for teenagers and adults is emphasized, because they can take care of themselves, and regarding psychological help, they can have information on who to call for group therapy or other peer groups therapy for teenagers and adults. Referral to COVID centers is very important as a mental health problem can persist. So they can have a referral to COVID centers. This is one of the findings of child community clinics. 10% is depression, not so much. Anxiety is 10%. Post-traumatic stress disorder is not so much as well for children. They're only 2 to 5%. Fear of COVID is more likely experienced because children will always have fear. Relationship difficulties is only 5%. Sleep disturbance is the most psychological manifestation of post-COVID-19 pulmonary sequelae because of coughing and breathlessness. So they will have sleep problems. Adjustment disorder, especially on activities of daily living, they will need help. They cannot do things on their own for the first few weeks of post-COVID-19 infection. Memory and concentration will also be affected as a mental this uh, experiencing of disabilities. For adults, depression is more likely high and anxiety is more likely high to be experienced after COVID-19. Post-traumatic stress disorder is also experienced, and the fear of COVID is lesser in addition to depression and anxiety. Interpersonal difficulties is not measured on post-COVID after hospital discharge. Sleep disturbance, sleep problems is also not measured, and adjustment disorder is not measured. Only memory and concentration. So the sorry, the adult ICU post 3 months, for example, you have been admitted, the cases have been admitted in the ICU, and after 3 months, depression can occur. This is where the depression can occur. The anxiety can occur at 33%, and post-traumatic stress disorder symptoms can occur as well. The fear of COVID is likely higher for those who have been admitted in the ICU. The relationship difficulties is experienced for those who are admitted in the ICU because the ICU has more prone to fear of death, and the relationship with their spouse or their relatives will slightly be reduced, giving them difficulties to relate again. Sleep problems will always be experienced after ICU because in ICU they usually give muscle relaxants or something that makes them drowsy and sleep. So the sleep problem may occur because you have been weaned off from getting all those muscle relaxants and you have to sleep on your own without those drugs that helps you do the relaxation or sleep. Adjustment disorder, sometimes you cannot speak after intubation. Sometimes they cannot walk on their own or do their own hygiene, activities of daily living, and that will give them psychological problems with adjustment disorder. Memory and concentration will always be an effect because of anesthesia or some drugs that can reduce the memory and concentration. And it can also give a lot of psychological effect. For pregnancies, post-operative delivery, depression can occur as postpartum depression. Anxiety can also occur because they are anxious of whether they are prone to transmit the infection to other people or to their neonates. Post-traumatic stress disorder symptoms because of the trauma that they have experienced from COVID-19. Fear of COVID, again, is increased on post-operative delivery after delivering with COVID-19. Relationship difficulties will also be there because people will be afraid of being with you, especially the neonates, your child, the baby that you had. You will be having relationship difficulties since they are afraid of you transmitting the COVID-19. Insomnia will always be there because you cannot sleep at night due to stress and anxiety. Stress and burnout will also be there for post-operative delivery of pregnancies, and it is 50 to 70%. So what are the challenges of nurses overall? The overall challenges is that there are new disease that can emerge after psychological treatments, uncertainty in healthcare society, the fear of getting involved, services across the country are patchy, Motivation to parents versus child psychological self-care is there. These are challenges to motivate. Unidisciplinary pathways is also a challenge versus COVID-19 confinements, because we don't want to confine them anymore. We just have to put them at home, and the unidisciplinary pathways are recommended. Biopsychosocial approach are difficult to achieve as well, and these are also a challenge. So one of the conclusion is that the post COVID-19 pulmonary sequelae will be divided into 4 tiers. The patient-led rehabilitation and recovery, that's the first one. We want them to recover and rehabilitate on their own. Generalist assessment, support, and rehabilitation, which means to say the nurses in general can also help in the rehabilitation. Specialist assessment, support, and rehabilitation, which means to say if the patient cannot do it on their own, the general nurses can help them. If the general health nurses cannot help them, they will be recommended to specialists. So the fourth tier is the specialist management of specific complications on pulmonary sequelae, such as the SARS, the MERS, those pulmonary sequelae that can occur that are difficult to manage with rehabilitation. They need to be reconfined for further management of specialists and specific complication management as well. So the radiological follow-up will not change management for some patients. Example is severe cognitive impairment, limited life expectancy less than 6 months, unlikely to be troubled with breathlessness due to severe limited mobility. And these patients should be assessed on a case-to-case basis using a patient-centered approach, focusing on symptom review and management. Another conclusion is divided into physical, cognitive, and psychosocial and emotional care. So the physical care is the rehabilitation of loss of muscle mass through illness and deconditioning post-tracheostomy, post-thoracostomy, or post-intubation. We have to decondition them again. And intervention on breathlessness is also a conclusion. Cognitive conclusions are the processing of complete tasks such as homeschool, returning to work, going on shopping. Those are the cognitive. Memory and concentration must also be the role of the nurses. The psychological emotional role of nurses focuses on frustrations. What the patient will always ask the nurses, what is wrong with me? So these are what we need to tackle for psychological and emotional support. Fear, anxiety, low mood, emotional support can also be there. Depressive symptoms can also be there. And these are what we need to focus on as one of the roles and responsibilities of nurses. The summary is to look at self-care, and guided self-care is very important. Specialist intervention if self-care could not be maintained or could not be achieved, and complex cases are also important. So on way forward, Lincoln University College supports education for complex and treatment-resistant pulmonary sequelae. And we are also having multidisciplinary approach from diverse specialists and education on holistic formulation and management and planning for patients with pulmonary sequelae is also our aim, and bespoke collaboration to overcome barriers to change is one of our aim as well. So thank you very much for your time. These are the useful resources.
Attendees, any questions? We can post the questions in the chat column. So I will wait for another 1 minute. We'll see that whether any questions we are receiving on.
Okay, I should go to the chat column, right? Okay, no problem. Thank you so much.
Okay, I think there is no questions. Thank you, sir. Thank you for your detailed explanation on pulmonary sequelae during this COVID pandemic time. And this was a very wonderful and very useful session, very informative session. Thank you so much, sir.
Thank you very much.
Thank you, sir. Now I'm going to introduce our next resource person. Dr. Miriam Kellogg, Director, School of Nursing, Science University of Nairobi. Ma'am is a mental health nurse and an international research ethics specialist with long-standing and a wide experience in community and clinical mental health nursing practice. She has experience at various levels of nursing and healthcare form, clinical nursing practice to administration, education, mentorship, and leadership. She serves as a technical expert in advisory boards nationally and internationally. She has published over 90 articles in journals and abstract books of national and international and conferences too. Currently, Madam is in the chair of Nurse Midwife Educators Forum that supports strategies to foster resilience of nursing midwifery workforce during the post-COVID pandemic. We welcome you, ma'am, to present your topic.
Thank you very much. Are you able to hear me?
Yes, ma'am.
Okay, thank you very much for that very kind introduction. And thank you very much, Narayana College of Nursing, for giving me an opportunity. It is indeed my honor and privilege that I do not take for granted. May I ask a question? Do I share my screen? Or?
Yes, ma'am.
Okay. So let me share my screen. Are you able to see my screen?
Yes. Yes, ma'am. You can.
All right. Okay. So the topic I'm talking about this morning, for us, it is still 9 o'clock in the morning, is the impact of COVID-19 pandemic on mental health services. And I have some kind of framework. I shall start with the introduction. Then I will look at COVID-19 and mental health services. What are the mechanisms of consequences that will require mental health services? Then we look at the relationship between COVID-19, mental health, and increased demand for services. Then we finally look at the mental health services and COVID-19. And under that, we have two aspects. We look at the disruptions and we look at the innovations. So by a way of introduction, COVID-19 was first reported in China in December 2019. It was declared by WHO in January as the 6th public health emergency of international concern under the international health regulations, and thereafter was declared a global pandemic in March 2020. It was also reported that it was the major coronavirus outbreak that has caused significant socioeconomic suffering in the past 20 years, and it is remembered as the first pandemic in the 21st century to affect countries across all continents except Antarctica. Now, coronavirus has caused a lot of mental health problems globally, and this is because of fear of contracting the contagion, the related transmission prevention measures, and the subsequent economic recession that comes with it. As at 6:45 p.m. CEST time, 14th June of 2021, the WHO reported that over 175 million are confirmed cases, and there have been over 3 million deaths. And today, we are on the 17th, so this figure may have changed. So what are the mechanisms of consequences of this COVID-19 on mental health that make it require more mental health services? If you look at this WHO report, you will realize that it covers all the WHO regions, and that there are many countries which are hard hit. And globally, we're talking about 175,333,154 people who are affected, and over 3,793,000 and 230 deaths. And this has effect on the people. So transmission prevention public health measures which must be undertaken to try and curb the many deaths that we are having include social distancing and social isolation. They also include quarantine, lockdowns, restricted movements, curfews, and because of the nature of the contagion, it means that when you have a member of the family that is affected, then, and they unfortunately die, then you will have bereavement in isolation. And we can imagine if you are losing a family member, this is a loved one, the protocols that we usually take culturally to respect the bodies and continue with the funeral arrangements are not done, and we cannot even have adequate number of relatives to come and condole with us, then this actually has a lot of effect on our mental health. And because of the lockdowns and restricted movements and social distancing and social isolation, we have had people losing their jobs, and this has effect on economy. So we have had a lot of economic recessions, and this has also triggered mental health conditions for people who did not have mental health problems, but it has also exacerbated the people who have mental problems. So working at home, we know that this is what is happening in most areas. Temporary unemployment and job losses, homeschooling of children, and lack of physical contact with other family members, friends, and colleagues have been associated with a lot of increased sexual and gender-based violence. So many people are also facing increased levels of alcohol and general substance misuse. My predecessor has talked about insomnia, and anxiety. There are also direct effects of COVID-19 on the nervous system, and this has led to some neurological and mental complications such as neurocognitive disorders if we are using DSM-5, and stroke from hypertension. Now, people with pre-existing mental or neurological or substance use disorders are more vulnerable to COVID infection, and they have a higher risk of severe complications and mortality. These figures show us how mental disorders have increased in association with COVID-19. In January 2019, before we had the contagion, from the American numbers, there were 11.0% people with anxiety. But in January 2021, that is a year later, associated with COVID-19, we are seeing that that number has been multiplied by 4. The same goes to this figure 2, where we have seen an increase in the symptoms of anxiety disorder, symptoms of depressive disorder, and symptoms of anxiety and depressive disorders. So there has been increased incidences of mental disorders associated with COVID-19. If you look at this other figure, which is basically from the United States or North America and Europe, we still see that there has been a lot of stress, anxiety, or depression that has been associated with the pandemic. So definitely, we can see that COVID-19 has had an effect on mental health. So it has caused a lot, it has increased the the incidences of mental disorders. But mental health also influences somebody's risk of getting COVID-19. Because if we have a mental health problem, it is unlikely that we shall participate in those transmission prevention measures that will reduce the incidences of COVID-19. And definitely, therefore, this increases the mental health service demands. So this figure here is trying to explain that COVID-19, we have the transmission prevention measures that have been in place that I have already talked about, like social isolation, rejection, stigma, and all of, that cause the transmission prevention measures like social isolation, changes in bereavement plans, those ones cause stigma. And they also have an impact on socioeconomic status of every country. They are likely to lead to mental health conditions like depression, suicidality, anxiety, post-stress, post-traumatic stress disorders that my colleague has talked about. And so this causes demand for mental health services. This figure here, which I also retrieved from very respected scholars, was done in 2020. It also goes to tell us how, apart from COVID-19 action on mental health, we can also see what is it about COVID-19 that can also be a moderator for mental health issues. So if somebody has lack of infectious disease knowledge, they lack promotive health behaviors, they lack issues of assessing mental health, they have economic problems, there is change in sleep patterns and nutrition or sleeping problems, then that person is likely to develop mental health problems. And now this is compounded, and the ones we're talking about is anxiety, depression, stress, and we know that all this can lead to violence that we are seeing so much, and also suicidality. Instead of us having increased mental health services that is required because of the demand or because of the many incidences of mental disorders that increases the prevalence of mental disorders, we are seeing a difference. So what are we saying here? That COVID-19 pandemic has increased the demand for COVID-19, for mental health services, and yet we are seeing that there is disruption in those mental health services. So we're looking at the disruptions that we shall start with, and we want to majorly discuss the observations from WHO survey, which was done among 130 countries between June and August 2020 in its all 6 regions. And it is unfortunate that in 93% of these countries, while the demand for mental health services is increasing, there is disruption in the critical mental health services. And we are seeing some of the disruptions that we shall see in the next slide. But why are there disruptions while we know that the demand of mental health services is high? One is that there has been the redirection of courses of resources to COVID-19. We know that in any country, resources to mental health services are actually limited. If you look at the Ministry of Health resource allocation, you will find that about 2% or 1% funding is allocated to mental health services. So in COVID-19 now, the resources, even the 2% or the 1% that has previously been allocated to mental health services has been reduced. Further, there has been reduction in outpatient services consultation because people fear of contracting the virus. Many people do not want to come to the hospital facility, especially in the beginning, because they associate the hospitals with COVID and they fear. Then, even for the practitioners, there has been fear about conducting face-to-face visits because we also fear to get COVID-19. Then there are people who are in the hospitals themselves. There is increased risk of infection in long-stay mental health facilities. And if I can give you an example, in our national hospital in Kenya, we had an outbreak of COVID-19 in one of the wards, and patients were so scared. Their relatives were so scared they were not coming to visit them for a time. We had students in that ward who were undergoing mental health nursing clinical placement, and they had to be removed from those wards to be stopped for some time. When we talked with the staff to go for the test, many staff did not want to go for the COVID test. A few went, and they were given 14 days off. So what does that mean? It means reduction in the mental health professionals in that ward. There is increased risk of, there is increased workload to mental health workers due to COVID-19. I've just said that when a patient develops COVID-19 and a member of staff also tests positive, then they are given off, and so there is increased workload. And then there is also burnout, and burnout, they also cause further shortages. So what are the actual disrupted mental health services that we are seeing from the WHO study? There were the children and adolescents. We know that children and adolescents are very vulnerable groups with regards to mental health problems. But 72% countries in this study of WHO among the 6 regions, and 6 regions are all the continents, there were 72 countries that 72% of the countries reported that there were disruption in the mental health services. In all the adults we know, these are the people who are likely to develop anxiety, depression. They are also likely to develop neurocognitive disorders, even in the absence of the prevention or transmission prevention measures. Now we are realizing that 70% of the countries, there is disruption in their mental health services. In antenatal and postnatal services, where they are likely to develop maternal depression, 61% of the countries reported that there was disruption in the mental health services. When we come to counseling and psychotherapy, 67% of the countries reported that there was disruption in critical harm reduction services. 45% of the countries reported that treatment for opioid dependence was also disrupted. And there were emergency intervention services that have also been disrupted. Emergency interventions, you can remember somebody having prolonged seizures or fits. There are interruption in such services. Severe substance use withdrawal syndromes, and we know this is a psychiatric emergency. 35% of the countries reported that there were disruption of the services, and delirium also, there were disruption of services. When we come to access of medications for mental, neurological, and substance use disorders, 30% of the countries said there were disruptions. And school mental health services, 78% of the countries also reported that there were disruptions. Then we go to this other aspect that is blocked from my computer. I'm not able to see it clearly. The workplace mental health services were also disrupted in 75%, was reported by 75% of the countries. Okay. I'm unable to move my slide. Okay. So we have seen those disruptions. So what are the implications of COVID-19 to mental health services in terms of innovations? I have this document that is from the Indian Journal of Psychiatry. I believe that you may have seen it. So what are the innovations? We realize that there have been disruption of the services, but now we are thinking, how can we have renovations to reorganize the mental health services so that we can increase access, so that we can have those services that are acceptable and they are affordable. If we have all this, then we know that the access will be increased to the vulnerable population, to the mental health professionals, and all other members of the community. So what has happened here now, there have been telemental health, which was also reported in 70% of the countries. So this is a positive implication of COVID-19 to the mental health services. The disruptions were the negative impacts of COVID-19 to mental health services. So we have teletherapy, where we have the members of the health professionals talking with their patients online and suggesting some kind of interventions. We also have call centers or helplines, And I will give an example of what we are doing here in Kenya. Our National Nurses Association, in collaboration with other key stakeholders, have had helplines where anybody with an issue, and it is on a 24-hour service, anybody with an issue can call, and they will be assisted. they are assisted. Their information their information is collected. If there is somebody close to them in where they are calling from, they can be referred, and they can be given answers. As a nurse midwife-led forum in Kenya, which I chair, we also have webinars. And in our webinars that we conduct every fortnight, we educate the nurses on topical issues. Like the last one that we talked about was on last Thursday, was forensic issues that are there now in COVID-19. What are the experiences of the nurses with regards to forensic issues? What can they do if they are faced with such problems? So we have several topics to teach the nurse midwives as a way of helping them to be resilient to the conditions that they are facing. We are also hoping to devise a method here now that will help to improve the work environment, to reduce the cognitive overload, and also to try and ensure that the work environment is a comfortable place. So these are some of the innovations that have come up as we think of the mental health services. So we are thinking of the mental health services for us as nurse midwives. We are thinking of the mental health services for the frontline workers who are the nurses. The teletherapy for the patients, the call centers are for the patients, the members of the public, and also for healthcare personnel. There is also need to reorganize mental health facilities, which has been done. There are open spaces for outpatient clinics. If you walk into the most of the mental health facilities in Kenya, we are using the tents to ensure that we are seeing patients in an open space. That comes with another challenge of privacy. So the patients may want to withhold information because we're in an open space and they are fearing that somebody is hearing their information. So they may not quite give you all the information. There is also social distancing within the wards. How do we reorganize our wards, which are traditionally overcrowded? If you come from a third world, you will notice that most of the time we have the bed occupancy is about 120%. So how then do we reorganize? It means we must have the beds organized in a manner that there is a space of about 1 to 1.5 meters in between. This has effect on the number of patients whom we can admit within a certain ward. But that is what we are doing. How about the mental health workforce? How do we ensure that that they also keep social distancing? For example, how do you receive report for the patients? These are very basic issues that we are discussing, but they are very important because we need to receive report in patients. We need to give report before to one another at the end of the shift, and yet we have to practice social distancing. So those are reorganizations that we are all discussing. Then we have had increased home and community services. So we really don't have to admit each and every patient. We are trying so much to encourage community and home mental health services. The other issue that I have not put here, but it's important that we are considering in the reorganization of our mental health services, is the interaction with patients. we realize that in mental health, the facial expressions are usually very important. You want to observe your patient as you are doing the mental status examination. We want to observe the affect and compare with the mood. We want to see the lips. We want to see any other facial expression. But now in a situation where the nurse has the mask, the patient also has the mask, the psychiatrist and all other healthcare personnel have masks. This interaction is also interfered with because we cannot observe the facial expressions, which are very important, non-verbal communication mechanisms. Then we have the structured letter therapy. This is a form of written counseling where the patient can discuss with the counselor over the phone, and the counselor can write the information, and from that put in intervention that the patient should be able to have, and this can be passed. We've talked about home-based therapy care. So we also thinking of how do we deliver psychotropic medications to the person at home. Traditionally, they are supposed to come back to the clinic and then they are given the medication and then they collect. But now there's a reverse kind of mechanism where we visit most of the patients at home and we take to them medications. And then there's a lot of use of e-prescriptions. I talked about the counselor, remote written counseling, but also with prescription, there is a lot of e-prescriptions. And this reduces the time that the patient has to come and wait in the queue and to expose themselves to the environment and other patients for to the risk of COVID-19. These are very good. Mechanisms or very good innovations to ensure that the mental health services are still affordable and accessible to our population. But we remember that they come with economic implications. In a situation where funds have been redirected to COVID-19 and leaves us with very little funds to be able to have these innovations, then that becomes a challenge, as we are going to see. So what are some of the challenges that interfere with uptake of these innovations? I have already said one, but culture is also a big challenge. I don't know whether this happens in other countries, but we have seen that there are some people in our countries who don't believe in the existence of COVID-19. There are still a lot of myths about COVID-19. And especially when we have scientists also having conspiracy theories. And this confuses the people. So we have a culture where part of the population do not believe that there is COVID-19. And so what does that mean? It means that they will not bother about the innovations for prevention of COVID-19. There's also non-compliance with prevention measures among the politicians, and sometimes there's very little that the law can do about them. If you have seen, I don't know how many of you have been following up in African news, you see, you may have known about our late president of Tanzania, not Kenya, who did not institute measures for COVID prevention, measures for to prevent transmission of COVID-19. But we have also seen politicians when they are addressing their followers, and the followers don't have any measures, and there is nothing done about it. Then there is also availability of resources. Mental health and psychosocial support exist in the national COVID-19 response plans. in about 89% of the countries. But when we look at how much is being used to support those plans, then we shall realize that only 17% have added some kind of funding support to those activities. So in as much as we want to reorganize our health services, we may not be able to do it because lack of funding. Then there's the issue of disparities in the uptake of innovations. We know that in the Western countries, the innovations are likely to take up. If we're talking about technology, in Kenya, we are struggling with technology. We are trying helplines, the way I've said, but we are only at 50%. In other countries, in high income countries, they could be at 80%. So there are many countries also that do not comply with WHO recommendations to the letter because of the culture or because of the funds. The allocation of resources to mental health as an integral component of response and recovery has been one of the proposals of WHO. To what extent it is happening in countries, it's good as your guess and mine. Then we should also reorganize mental health services in a manner that we monitor changes and disruptions in services that is taking place, and then we take appropriate actions. We should also repurpose mental health infrastructure and staff to support the COVID-19 response now and in the future. There could be difficulty of conducting virtual consultations when many people do not have access to the technology required, which I have said earlier on. And so in summary, I want to use this figure, which I borrowed from scholars. This is done in 2021, COVID-19 and its consequences on mental health. We know that the COVID-19 has impact on special populations, children, adolescents, and young people. We need to equip people to protect their well-being. There are also issues of healthcare professionals. There are people with pre-existing mental health conditions who are now unable to get their drugs or attend even follow-ups or get to the clinics, and therefore we are seeing a lot of relapses. And then there are the homeless and the refugees. So we have said then, and we also have the COVID-19 patients whose mental health are also affected because of the condition. So we have talked about the responses that we are supposed to do, the telemedicine, teletherapy, or telehealth, establishment of helplines, infection preventions must also be continued. Community outreach services is important. Healthcare providers training is very, very important. Counselor recruitment, we realize that many people require counselors at this time. And there could be alteration of healthcare facilities and the modifications that we've talked about, with the goal of protection and enhancement of public health conditions to adapt to COVID-19 pandemic, while we are also addressing the socially disruptive consequences that are occurring regionally and globally and affecting people's mental health, leading to demand for mental health services, which we have to have innovations for people to continue having the services now and into the future. And with that, these are some of the references that we used. And I want to thank you so much for giving me the opportunity and for listening to me. Thank you so, so much. Over to you, Chair. You are muted?
Yeah.
Madam, you are
Yes,
muted?
yes. Thank you so much for your excellent presentation, ma'am. We'll wait for another 1 minute. We just we'll wait, see, is there any questions they are keeping in the chat column?
Okay, can I pull down my presentation? Then now I can be able to see the chart, or let me see what I can do. Oh, sorry. I'm not able to see the chart. The question and answer section, I can't see that.
If they are keeping the questions, I'll inform you.
Okay.
I'm waiting.
Thank you. As we are waiting for the questions, I think it will be my pleasure if we can collaborate with the Narayana College of Nursing so that they can also join us to do what we are also doing here, and we can evaluate the impact that it has had in ensuring continuity of mental health services to our populations during and post COVID-19.
Sure, sir. Sure,
Thank
sure.
you.
Attendees can post your questions. If you have any question, you can post your questions in the chat column. Okay, till now we have not received any questions, ma'am. Thank you so much. It was very informative and regarding this mental health services, especially what is happening globally and what are the new innovations come up in this area. Actually, this was a very good informative session. Thank you so much.
Thank you.
So before going to next session, we would like to take a 5 minutes of break. Okay, we are breaking for lunch break, and after the lunch break, we'll follow up with the afternoon session by 2 o'clock. Thank you. Stay tuned. Participants, if you have any questions, you can just put in the Q&A session or in chat column so that we can post the questions to the panelists and we'll get the answers from them. And later we can give you the answers regarding the queries what you have made. So thank you for attending the session, and post-lunch session will be started by 2 o'clock. Seeing you soon.